subject of disparities begins when the epidemic began. We were getting sick more often and more severely sick than our majority counterparts because of the whole issue of premorbid conditions, because of pre-existing disparities in healthcare. When the vaccination became available, you would think that the sickest would be the first in line. But racism is about the structuring of disparity. We were in the back of the line, though we had the greatest need. That's when I asked our staff people, talk to whomever, I want to be a shot distribution site so I can put my people at the front of the line.
Black people were more at risk for COVID-19 impacts, and we're less likely to get vaccinations. And that's due to vaccination clinics and information not being readily available to them in the ways that they can easily access it. We've had an ongoing relationship with King County, and they have reached out to us and they said, hey, we are having issues connecting with our African-born and African American counterparts. What do we need to do to make sure that we get these vaccines into your community?
People were listening to back channels of the internet. People were going Tuskegee crazy.
Our history doesn't prove well in terms of a lack of trust for medications. I've had my own personal side effects of medications that always kind of plagues me. And so I was not going to consider any type of vaccination. That was a no-no.
Let's respond to King County and let's let them know we'll do vaccinations. We're going to be doing it at church houses. We want to make sure that the statistics that you're giving to us is specific to African-born, African American, and we want to make sure that the numbers that we're bringing as far as with King County are representable and they're accessible.
AARTH was coming through the church through other people, ran in some other people that was a member of the church. And so there were two separate things when I got involved. So I was already working in the church as a deacon and as a member of outreach. And then the AARTH program started through this technology type program. And now the two are coming together.
So we provided the space. We also provided a place that's trusted by the people that you were having the most difficult time getting to get the shot. That's Black folks. We partnered with them in the promotion to get people to come. Black folks trust the Black church to be a place that is working on their behalf.
When I heard that our church in the beginnings was going to set up a clinic with AARTH, I thought, well, I'm going to consider that.
We partnered with Providence, Harborview, UW Medicine, and Mary Mahoney Foundation. That is a foundation of Black nurses. They would just send us an email and say, hey, we have 1,000 vaccinations. Can you get these dispersed by next week? King County Department of Health were huge on this with their partnership with CDC. We partnered with Department of Health, the Emergency Feeding Program, and we partnered with Northwest Harvest, and they gave us about 150 gift cards with $50 balances for groceries, and we sent those out to people who got the vaccinations. With those efforts, we were able to vaccinate more than 8,000 people, and out of those 8,000 people, more than 6,000 were African-born or African American.
I didn't realize how much I miss people. Being able to hug and to embrace, to share a meal, to laugh and talk, the simple things in life.
We did it, and we didn't do it out of fear of our white counterparts. We did it because it's what's best for our bodies.
Really proud of the contribution and what AARTH does in the community.
It's not over.
How does the mission of AARTH in partnership with the church develop the long-term relationship? Always assessing and reassessing what are the issues that are threatening to healthy living individually and collectively. So we can't retire. We can't break the partnership.